Pain during sexual intercourse is very common, and at least once in a lifetime you have had either discomfort or pain during sexual intercourse. It is not normal to have pain during sexual intercourse. An intercourse should be pain-free and with no any discomfort. But again, what causes pain during sexual intercourse? Can it be treated? Hey good people, once again welcome back to my YouTube channel. I'm Nurse Janet, and in this specific video here today I want to talk about causes of pain during sexual intercourse, because we all understand that a sexual intercourse should be pain-free. And again, another important thing that you should note, and before going to your gynecologist to seek advice, it's very important to identify the site where you are getting the pain from. Is it the outer part? Is it the inside? Or is it after sexual intercourse? This is very important because this is what your gynecologist or your doctor will use in making a good diagnosis and knowing exactly how to help you. Pain during sexual intercourse is much common in women compared to the way it is in men. And again, let's move and see what are the causes of pain during sexual intercourse in ladies. First, before we go to that, we have to understand there is the physical and the emotional pain. On the physical pain is the pain during intercourse. The pain during intercourse is divided into two. We have the superficial pain and the deep pain. Just as the name says it, the superficial pain is the pain that you will feel on the outside. You understand exactly how the vagina is, or the female reproductive organ. The outer entrance, which entails the vulva, the labias, and the vaginal entrance or opening. That is where the superficial pain is. The symptoms of this kind of pain is whereby a woman feels pain at the start of penetration, just before the man starts to penetrate. It's already painful. Another way you can identify that you have pain at the superficial entrance is when you are trying to insert a tampon. You will also realize that you are feeling pain and some discomfort. It's just pain on the outside, or you will feel like itching and burning just on the outside as the man tries to penetrate. And this kind of pain also, you realize that after the man has entered, the pain will be now minimal, compared to the other pain. Let's move to the causes of the superficial pain. What can lead to this pain just outside before the man tries to penetrate? The first cause of superficial pain is vaginal dryness. When it is dry, it will cause friction and it will lead to pain. Vaginal dryness shows that there is not enough lubricants from a woman. And what can lead to this? We can have medications maybe that you are taking. Another thing is inadequate foreplay. You were not well prepared for the sexual intercourse. And another thing is that during breastfeeding, the hormonal changes in your body can always lead to vaginal dryness. The solution to this problem is using a lubricant during sex to avoid that friction that will cause discomfort and pain. The second cause of superficial pain during sexual intercourse is vaginismus. Vaginismus is a sudden spasm contraction of the vaginal muscles. The pelvic floor muscles all of a sudden become tensed, contract, making it very difficult for penetration to occur. This can always be corrected by doing pelvic floor muscles exercise. You can do the pelvic exercises to relax your muscles. Another good cause, which is very common amongst our women, is irritants. You are using those strong scented soaps, perfumes, very hot baths to wash down there. You are causing a mess. You are causing an irritation to the skin, and this will be felt during sexual intercourse. You feel those burning, actually when the skin is inflamed or whatever. You'll feel the burning, the itching sensation during sexual intercourse. So for a healthy vagina, just use mild soap or no soap at all. You can just use plain water. It's quite still healthy. And if at all you really have to use a soap, use mild scented, very mild. It's okay. The superficial pain can also be felt when a woman just delivered and maybe you've not properly healed, and there you are going for sexual intercourse. Actually, you'll feel some pain because maybe you had even an episiotomy. And another cause for this superficial pain is anything that brings the inflammation. We have the urinary tract infection, which causes irritation down there, and we have the vaginal thrush, vaginal candidiasis. All these can lead to superficial pain when a man tries to penetrate, because it affects much on the outer part of the vagina, that is the labia, the vaginal entrance, and the vulva. All these are affected by these inflammations and can be felt during sexual intercourse penetration. And let's now move to what we call deep pain during sexual intercourse. Just as the name implies, it's pain felt deep inside your vagina, deep inside your lower abdominal region. Yeah, the pain can be throbbing, and the pain is felt after the penetration. Just as the act is ongoing, you're literally feeling painful. The pain can be one throbbing pain, and the pain can also be felt minutes to hours after the sexual intercourse had stopped. So, what brings about this pain? If you experience deep pain during sexual intercourse, actually it should be a cause of alarm, because most of the deep pain is a symptom of either gynecological conditions or even medical conditions. The gynecological conditions that can bring about pain during sexual intercourse include endometriosis, the pelvic inflammatory diseases, the tumors that can be benign or even malignant tumors. They can always start by a symptom of experiencing the pain, that throbbing pain after sexual intercourse. So there is so much gynecological conditions that should worry you, and this is why if you feel this pain during or even after sexual intercourse, it's quite important to go and seek gynecological advice. Other medical conditions like inflammations of the surrounding organs such as the kidneys, and even sexually transmitted infections like gonorrhea, chlamydia, all these can always lead to pain during sexual intercourse that is felt deep inside the pelvic region. Pain during sexual intercourse can again be psychological. Yeah, you can just have psychological pain, it's in your mind. And these are the people, maybe they've had past traumatic experiences like rape, or they are not on any contraceptive, like a girl is not on any contraceptive and she fears getting pregnant. Actually, she won't be comfortable throughout the act. And again, if you are depressed, depression comes with a lot of baggages. You won't even feel like you are enjoying sexual intercourse, and actually, your sexual intercourse should be enjoyed. All these conditions can be treated, and you can as well enjoy your sexual life once again if you are a victim of pain during sexual intercourse. As long as you know the cause, the exact place where the pain is occurring, it will help in correct diagnosis and proper management of any of these conditions from your doctor. Thank you for watching, and let's meet in my next video. I'll be sharing something different. Kindly subscribe if you've not done so, so that we can move together.